All right. Good morning, good afternoon, good evening, wherever you are in the world. My name's Mick, founder of the ACL Hub, and I've got the unbelievable experience of talking to Arash from the Prehab Guys today. Arash, welcome to our show and welcome to the ACL Hub community.
Yeah, thanks so much for having me. Excited to be on.
Oh, thank you. I shouldn't call it a show. It's a community. It's a community. It's a little hub of people. It's a nice growing family of health professionals, but also to patients who've also injured their ACL, their ACLs. And I think the whole part of doing this is trying to get inside, just in the minds of people who have injured their ACL, but also to share some of your experiences, some of your wins, some of your losses. And I think for some people, who have injured their ACL, just to know there's other people out there going through the same thing as them, and they can sort of feel comfortable with the process that they're also going through is often felt by others. And for physios and strength and conditioning coaches, getting an insight as to what it's like from a patient perspective. Now, you are both a physical therapist and a patient, so you got this really unique experience of being on both sides of the table, which I really want to dive into. So I think this next little 45 minutes chat will be really insightful. So yeah, appreciate your time, mate. Thank you.
For sure. No, those are some great points. Excited to dive in. I know that it's helped me a lot just talking to other people, even though I know the research and I've worked with patients, but being on the other side is definitely a different experience. And so I'm happy to shed some light on that as well.
Yeah, no, thank you, mate. Well, let's take it back to the moment it all happened, if you don't mind. Taking a step back in time. What was your Can you take us back to the injury? How did it happen, and what were
Totally. Yeah.
those moments like for you?
Yeah, so April 29th, I was playing soccer and I played soccer my whole life, played
Mm,
collegiately, and haven't been as consistent with it the last few years. So, it's no surprise that I'm maybe at higher risk because I have not prepared my body as well.
yeah.
I knew that going into it, so I played defense, even though I normally play forward and attack. And so I tried to keep it a little bit easier. But I cut, and immediately it was non-contact. As soon as I cut, I heard a loud pop. I actually didn't
Yeah.
realize it was me at that moment. I heard it before I felt anything. And then shortly afterwards, as I tried to move off to the other leg, my leg just gave out on me, and then I realized it was
Wow.
myself that that was where the pop came from. And right after that, I actually couldn't feel my leg much. It kind of went numb, so I was worried that there was like some nerve involvement. But after a minute or two, I realized that yeah, my leg is fine. It's there. I had high concern that it was the ACL. Likely knew at that point that's what it was.
Mm,
I rolled over to the side of the field, called a buddy, Dr. Nima Mehran, who is an
yeah.
orthopedic surgeon and knows a lot about ACLs. And I was talking to him and pretty much was suspecting that, but went to his office the next morning. He tested and it looked pretty. We were pretty confident it was an ACL tear, and then imaging the following 2 days from that point
Yeah.
on, yeah, it was confirmed ACL rupture, tibial plateau fracture, arcuate ligament. There were a tear. There were two some other smaller strains and sprains, but there was also two tears in the menisci that
Yeah.
we were a little concerned with. But yeah, so did a number to that knee, and
You
that
sure did.
yeah. And the crazy part is that I've had no history of any knee issues throughout all my years of soccer, basketball, tennis, all these sports. But all it takes is a moment that your body was not prepared for to create that.
Yeah. Yeah. Well, it's a, it's you just really fascinating hearing people's injury experience. Like you hear so many people have that immediate, the pop, they hear the pop or the crack, and they have this immediate, really intense pain for, people recall 5 to 10 minutes, and they can't get off the ground. And to me, you're sharing a different story where it's kind of like you couldn't feel your knee, so that kind of like there didn't seem to be as much pain, and that pain experience wasn't nearly as bad as what other people have sort of experienced. Yet you had so much extra injury with a tibial plateau fracture. I'm sure that's it's a significant injury that doesn't tickle. So it's fascinating hearing the different immediate responses to the person.
Yeah, it definitely didn't feel great. So it was
Yeah.
it definitely had there was pain, but it did subside fairly quickly.
Mm.
Um, and there were a couple people that I was playing soccer with that came over afterwards, and they talked about their history with ACL injuries because it's very common in soccer.
Yeah.
And and I wasn't able to fully walk off. Like I had to have some support with someone helping me with like the maybe 80% of the load of my leg, but I was still able to kind of move off. The tough part was it's my right leg, which is my driving leg, which
Yeah.
even think about like which leg is it, and it has a big impact both pre-op and post-op with the ability
Yes.
to get
Yeah. To
around
drive. Yeah.
exactly to drive. So that limited me for a bit as well, but yeah, shortly afterwards, like there was some instability, which led me to not be as mobile, but I was able to walk around fairly good within like maybe a week or so.
Yeah. Yeah. And so, yeah, injuries to the menisci and tibial plateau fracture. It was that, and, a couple of other minor sprains as well. Was that something that kind of led you down and yes, like you've had surgery since we know, but was there was that decision made early, or was it something that you kind of sat with for a while? Or yeah, tell us a little bit more about
Yeah,
what happened next
yeah.
after the ACL.
It's a good question. So I, at that point, put, like as you know, as anyone that has an important decision, you should lay out all the options that you have.
Mm,
And so I laid out all the options. I didn't want to just be like surgery just because something is torn, because there's a lot of ACL copers that are out there, and I've worked with many myself. And so my decision was largely looking at some of the long-term data and talking to other people. I felt like, uh, and I know it's debated a bit. I just knew that I wanted to get back to cutting and pivoting sports, and that led me a little more towards the surgical route.
mm,
I also kind of in myself wanted to. I don't know. I've seen a couple ACL copers that never got fully back to
yeah.
100%, and some that have. And I didn't want to really take that risk, even though there's also a risk with ACL reconstructions as it is. It's not like 100% of people
Mm,
return back to
mm,
sport either. So
yeah.
to me, after talking to people, I thought there was a slightly higher chance of returning back to sport with that. And I'm not sure if maybe you have some data
Mm,
um, to share as well, but that was kind of my thought process. And uh, I, yeah, I talked to a few people that I really trust more than even me doing a bunch of diving myself, and I kind of figured
yeah.
that okay, let me just go through this once and for
Yeah.
all. What do you think
Yeah,
about that?
and I think that's, yeah, you did make the right thing. I think part of the problem is when you try to treat yourself and you're like, you get that little bit of knowledge and that little bit of wisdom. I think it's really hard to remain impartial, and I think that's where you need to take a step back and let the experts help you. And whether or not that's one expert or it's multiple opinions you get from different physical therapists, different orthopedic surgeons, sport doctors. I think it's really important from a health professional perspective. You really take yourself out of that equation, which is quite a unique thing for us as people involved in health. So, yeah, look, it's there's no real right or wrong way, to be honest. The right way is for you, and that's what I've always say to my patients is that like you've got to think about. Yes, we can lay down all the facts and figures, but for some people over the next 12 months, the decision of what they're going through over that period of time is the best thing for them right now. Maybe fast forward, if this injury happened in 5 years' time, your treatment pathway may have looked a bit different too. Like you just never know. Like you just have to sort of think, okay, what do I want to achieve? What have I got on my plate for the next 12 months? And then, certainly looking beyond that, like what do I want to get out of my knee? And you're right, like the ACL reconstruction, it doesn't come without its flaws, nor does a non-operative and rehab alone pathway. Like every option has got some risk to it. It's just, what it comes down to is the treatment choice you make really has to fit with you and your schedule and what eventually you want to get out of your knee. And I guess the benefit of all the ACL reconstruction data, it's a path very well traveled. we know that things probably play out with a little bit more predictability over the next 1 to 2 years, whereas the COPA and the non-operative pathway is mixed with a lot of grey and potential loss of time. Because if you get 6 months down into your rehab and you're not really happy or comfortable with what's going on, then we're kind of now having to take a step back 6 months in time. And for some people, that's not great. You know, they don't want to live in this grey world where at any moment they could be now back on the operating theatre. So I guess it just comes down to your personality type too, and that's what I describe to people as, if you're a black and white person, type A personality, maybe operation is better for you, because you have a little bit more of a clearer pathway of how things will play out over the next couple of years. If you're happy to live in this murky world of uncertainty, well then, yeah, follow this grey path, and who knows where you'll end up. So yeah, that's
That's a
kind of
great
how I set
way.
it out.
Yeah, that's a great
Mm,
analogy. And I didn't think about it like that, but
mm,
it's a very good point because for me, I have talked to and worked with significant, like maybe 20 times the amount of ACL post-op patients than ACL copers.
mm,
Um, like so, and I know that sometimes these ACL patients that I see pre-op end up trying to push this COPA route, but I would say that for me, the path traveled and proven to me and to others um, at a higher quantity gave me that reassurance. Because like the worst thing, like I've also dealt with a history of chronic back pain, and that's to me worse mentally because I don't have a clear path and I'm less limited than my knee, but I
yep.
also don't know what the future looks like versus my knee. It's it's a path traveled as you mentioned, and it's not
Mm,
perfectly linear, but you have an idea on a macro week over week, month over month basis how things should be
yep.
progressed. And
Yeah,
that helps a
exactly
lot
right.
psychologically for myself.
Yeah, yeah, agree. And what was so once you sort of had the meeting with the orthopedic surgeon and you sort of mapped out, surgery is going to be the thing. Did you have much time between injury and surgery, or did you have operation fairly soon after?
Yeah, I waited. I wanted to get surgery as quick as possible, but people
Mm,
talked me into waiting a little bit, which I think was a great, an
yep,
amazing decision. I waited about 7 weeks until I
yep,
got the operation, and that allowed me to, first of all, find the right person that I did want to operate. I did want to put all my options out there again, and I did go
yep,
with Dr. Nima Mehran, the one who I ended up calling the same night. But
yep,
I objectively tried to look at all the options that I had and kind of where I would feel not just the most confident, but like I would regret the least if things didn't go perfectly.
yep,
What that would have looked like. So, and then also I think that gave me time to really prehab the knee before
yep,
surgery, which is so critical and oftentimes not even overlooked. I think people even have an idea of what to do, that it's something that should be done, but the
yep.
importance of it I see firsthand with myself and also other people that
Mm.
haven't taken it seriously. So that was a very good call to wait a few weeks and do physical therapy during that process.
Yeah. And what did that? Because I think there's this perception too that prehab, or this sort of pre-op period of time, I think historically it has been a very, very keep the knee quiet and calm and kind of almost like bubble wrap you, which in hindsight probably isn't the best way forward. We know there are some really more proactive approaches. So what did that look like for you? Was it like a typical gym program type training? Was it modified in a way? Like, yeah, what did your pre-op rehab look like?
It got pretty intense fairly quickly. Like
Mm,
my progress post ACL tear was very fast. And I'm not sure how that compares to other individuals specifically, but I was surprised that like after a few weeks, I was able to start doing like single leg squats, and I didn't get
wow.
back to plyometrics or anything. But the load that I was doing, like with leg extensions, was very symmetrical, side to side by the time I was about to get surgery. So I was pretty impressed, and I wouldn't say I overly respected the quiet knee. I think I was willing to trade off a little bit more of
Yeah.
increase in strength before surgery, knowing that there was going to be some swelling, especially for myself. The swelling goes back to baseline fairly quickly,
Yeah.
pre-op as well. So I was okay with pushing, knowing that I was just going to be quiet the rest of the day and make
Yeah.
sure that I wasn't going to further strain the knee.
Yeah, and I love that too, because I think there is that trade-off, and that's why I try to educate patients on those early days that yes, there's swelling there, but we can train in the presence of that swelling, and the net effect is, as long as we're listening to your knee being sensible, the net effect is that swelling's now going to be slowly reducing down. So, we don't have to just sit around and kind of wait for this swelling to subside on its own, or just let it happen passively with other modalities. Like, you actually can get in there and work with that swelling, and you may be going 2 steps forward, and then 1 step back, but the net effect is you're going forward. And so it's funny, like, I reflect on a couple of patients that I saw in the last few weeks who were both acutely injured their ACL. They were both busy mums, and they kind of just cracked on with life. They kind of inherently knew they injured their ACL. They knew they hadn't. They knew their knee wasn't right. One of them had injured their ACL on the other side previously, but they just sort of cracked on with life. They're both busy mums with 2 kids. When they turned up for their first consult with me to get the confirmation, and to get a diagnosis and a management plan, their knees looked like there had not been an injury. Like, their knees were quiet, they were calm, they walked in without a limp, and these were only 3 or 4 weeks post injury. And so it was kind of like fascinating hearing their story, because I've seen many people who really wrap themselves up in bubble wrap and really protect and guard their knee 4 weeks post injury. They're still on crutches and they're limping with a really noticeable limp, and it's because they've been really passive with their management after their injury. So I think there's something to say in that, with a bit of healthy, tough love, to show your knee early, it can really set yourself up for some pre-op success, and then eventually post-op success afterwards too.
Yeah, it's kind of
Yeah.
crazy how that works, because intuitively you may think that you should do the least amount to allow for things to
Mm.
heal, but as physio, especially within the last couple of decades, you realize this not just for ACLs, but for a lot of injuries. Like, you got to stimulate the tissue a bit to allow for things to heal, and I think these teaching points are very important for people to understand.
Yep. Yep. Now, did you have much of a say in terms of graft harvest side? With Dr. Nima? Did you have much of a say there? Mm.
Yeah, we talked about that. We ruled out hamstring pretty early. Allograft, autograft, we considered myself a younger, healthier individual that probably has good tissue to use. So we went more with
Yep.
autograft. And then from the three popular graft sites, hamstring, quad, patella, hamstring we ruled out fairly quickly with slightly higher risk of re-tear. The patella and quad were the main two we were thinking through. The patella we ruled out because I kneel a lot for work, largely because of my back. I try not to sit too much. I
Yep.
have to kneel a good amount. So given that, I didn't want to, even though the risk is fairly low, I think it's like I've seen as low as like 5% a couple of years
Mm.
out into your knee pain, but I still didn't want to take that risk. And I generally have uh, decent, and they also looked at the MRI and realized
Yep.
the tendon that I have for my quad tendon was like very thick compared to even my patella. And so
Yeah.
the
Wow. Awesome.
downside, yeah, the downside there was probably smaller than even taking it from the patella, which is not always the case. And
Mm.
so I think that made me lean more towards that. And I mean, generally, my quads are fairly strong, and I wasn't as worried about the delayed recruitment of my quad compared to maybe some of those other risk factors like anterior knee pain. So,
Yeah.
uh, yeah.
Yep. So quad tendon repair. And there's unique sort of differences across the world also too, between surgeons, and some where they may take a bony plug from the patella, um, or make it a purely soft tissue quad graft. What did you end up getting done to your knee?
Yeah, we talked about that with the bone plug on the patella side, but we decided to, I forget the rationale, but we decided to go with
Mm.
just a soft tissue graft
Yeah.
and pull that through. And I have a pretty cool video. We're actually going to upload it to YouTube next week.
Awesome.
He recorded the surgery, so
Oh,
that'll be
perfect.
watch through.
Oh, well, I'll put that in the show notes. We can get that sort of watch too. That'd be excellent. So effectively, is the same as what a hamstring graft would be, anchored into the leg, but a quad tendon instead of a hamstring tendon.
Yeah, yeah,
Cool.
pretty
And
exactly.
what about the menisci? Do they have to be repaired as
You,
well?
that's, that's another good point that meniscus. So I was under the impression that I was going to get a couple sutures to repair the meniscus.
Yeah,
But the good thing of waiting is that it started healing on its own, and
cool.
so that 7 week period allowed for a lot of that to self heal. It was in the vascular zone, so we kind of let it do its thing, and I don't really have that discomfort that I used to have. So I assume that it's for the most part healed at this point. Granted,
Yeah,
I'm 3 months post-op, so I'm not doing everything yet, but
yep.
I'm happy that we didn't have to deal with that, as that made the limitations post-op a little bit easier on me.
Yeah, absolutely. That's a nice win, because well, it also two things there. Like it's the waiting and pre, because I'd imagine that if the surgeon, if you did have that early surgery, the surgeon would be more inclined to repair what he sees, and you would have had probably a couple of sutures put into those torn menisci, a week post injury. Whereas,
Totally.
letting the knee settle, letting sort of, Mother Nature look after your knee, there's that chance that those tears can heal on their own terms. So it certainly goes to show, like, sometimes it's really important just to be patient and wait. To me personally, I advocate for 3 months of rehab for most people. If there's more tight time demands, there's more professional aspects to their sporting endeavors, and we need to get things done a little bit earlier, I'll still push for at least a month to 6 weeks. But yeah, there's certainly that's a perfect example of sitting around and waiting, because as you know, the downside to having meniscus repairs early is that, yeah, you're really immobilized for the first 4 to 6 weeks. Plus side is obviously your long-term knee health is much better, but those first 4 to 6 weeks really suck. A lot of a lot of atrophy, a lot of joint stiffness, and a lot of difficulty to get moving. So yeah, it sounds like you dodged a bullet there, which is good.
Yeah, I mean, it's just like as a whole, it makes so much sense to wait. I know it seems counterintuitive again to like you tore something, you want to get it fixed as soon as
Mm,
possible. But the amount of people, because about 50% of our patients coming into the clinic are post-op ACL reconstruction.
yeah,
So I talk to almost all of them, and it's always helpful. The strongest correlation by far with how someone is doing is how much prehab they did prior to.
yeah,
And so making sure you have that time to build up the strength and range of motion prior to surgery is so critical. And I don't know how to emphasize that more, but it's yeah, something that it's tough because people want to use their PT sessions, at least here in the States. They have a limited amount and they want to use it post-op because
yeah,
that you need it post-op. I understand that, but it should be a requirement at least to have like a session to guide somebody or
yeah,
maybe a couple sessions to push someone in the right direction and even educate them on why this is so important prior
yes,
to doing this surgery. It's like, you know, you train for any strenuous event that you put your body through. Surgery is a strenuous event, and you have to
yeah,
prepare your body for that. And prehab is the way to do that.
yeah. That's a really good insight. And so, just for maybe the my sort of physios here in Australia or New Zealand or UK who are unfamiliar with I guess the healthcare system in America. So you're saying that after an ACL injury, there wouldn't be much access at all unless you're a cash paying patient, and
Oftentimes,
yeah,
yeah, often actually we're a cash paying out of network facility. So oftentimes for our facility, we get patients after they finish their insurance visits, and usually
yep,
it can be anywhere from like 3 to 6 months post-op, and they need
mm,
to get ready to still return to sport. So they come to us at that point, and then they do their testing and making sure they are prepared to return to sport because they've run out of their visits for the year. Unless
yeah,
they wait a little bit and that's not great either until the following year and re-up their visits. And every insurance is different, but this is a
yep.
very common issue that people have a limitation and hit that wall before they are back to returning to sport.
Yeah, but they won't get access before an operation, or they choose not to because they want to save their visits for after their operation.
Typically that. I think it's more
Yeah,
so
wow.
that the education from their physician and also from the decision that they decide to make for themselves is that
Yep.
they have, let's say a total of, I don't know, 12 to 20 sessions, and they don't value the prehab part when
Yeah.
in reality, one of those sessions beforehand is going to pay a much better ROI than saving all of them for post-op.
Yeah.
So,
Yep.
yeah, it's a,
Yeah, it's crazy how it just differs amongst the, yeah, like in Australia, for example, we get well, I work in a private practice, which is very different to like a public hospital setting where there'd be very limited access to well, one, if you injured your ACL and you were going through the public hospital system, you'd be waiting at least 12 to 18 months to have your surgery. You would probably get access to some preoperative physio or some kind of rehab within a hospital setting, but it would be really thin. The frequency would be really low unless they had a really good program in place where you could get back into group knee classes, for example. But the vast majority of people would be having their knee rehabbed preoperatively or ongoing in a private setting. And most people would be, yeah, it's effectively a cash-based system, probably with some private health insurance rebates, but there wouldn't be a limit necessarily on what they can get access to because it's kind of buffered. Like they'll still pay their fee, but they'll get some money back. So it's not as if they're getting complete coverage to a certain extent. It's a percentage off at the end of your visit, so to speak. So yeah, it's fascinating seeing the different systems around the world and how this plays out. New Zealand is very generous. I know they basically have coverage all the way through from injury. So the public health system, everyone gets access to high quality physiotherapy and care all the way through from injury through to surgery. Same thing with the Scandinavian countries in Europe. They've just got basically unlimited supply to good physios at the cost to the government. So yeah, crazy differences around the world.
wow. So then New Zealand and the Scandinavian countries, as long as there's medical necessity, physio is warranted and covered
Yep.
for the individual.
Yep.
Wow.
Yep.
Okay.
Yeah. And the emphasis in those two regions too is rehab first, unless absolutely indicated for surgery. So people do often have these extended preoperative time just by virtue of that's what the kind of the systems demand and advocate for, which is just a different complete mindset to the US and potentially even Australia and the UK. So yeah, fascinating differences.
No, yeah, no,
Yeah.
here's very much how can I generate the most revenue possible, and typically surgery would create that. Not, I mean, obviously there's plenty of good surgeons that understand the evidence. It's more so the system is set up for that.
Yeah. Yeah,
Um,
for sure. So you're now 3 months post-op and looking from what I've seen on Instagram doing pretty well. What's tell us a little bit about the 3 months. Are you
yeah.
looking after your own rehab or are you tapping into any colleagues for some unbiased advice and
Yeah.
progressions?
Yeah. I knew early on, I'm people have mentioned this before. I'm a much better PT than I am a patient. I do my own thing a little bit, but like I need and I understand that not that I need, but it's very helpful to have external guidance, especially because our clinicians here have worked with plenty of ACL patients, and that's, as I mentioned, like almost 50% of the population that does come in. So
Mm.
I wanted to make sure that I was in hands of people that have gone there and done that. So two of our clinicians, Monica and Andre, both are kind of rotating through, working with me both pre-op and up to where I am now, and that's been great in terms of guidance. I would say to take you through the 3 months roughly. I actually had an infection on the first
Oh,
week
wow.
post-op. Yeah,
Yeah.
that was very rough. That put me down. At first, I noticed redness in my leg, and I was like, "This doesn't seem right." And told Dr. Nima about it, and realized that he got me on antibiotics right away. Saw him, and
Mm.
it was cellulitis, and we weren't exactly sure why. Granted, it didn't. We're grateful that it didn't get within the knee joint
Yeah.
itself, and the sutures were fine. It was just my lower leg, and that second week, I was pretty much bedridden, fever,
Yeah.
chills. Like, yeah, I was
Ah,
out. Yeah, that was not fun. Having an ACL, being 1 week post-op is already difficult enough, and then
yeah.
having that, it's brutal. But
Yeah.
that after that, it was pretty smooth. Honestly, my pain has been very, very minimal, even from early on, which is surprising because I want to do more and I feel like I could do more, but I have to
Mm,
respect healing, and also my knee does swell up a lot. Swelling was
yeah,
my big issue. And just now at baseline, is it, pretty good, meaning less than like a centimeter compared to the
yeah,
opposite side. I probably was doing a little too much early on because it felt so good. I really haven't had much discomfort with it. If I push it, the only thing I notice is like a little stiffness in the knee. I did strength testing today and I am still not at 70%. I'm like at 53% of the opposite side.
yep,
But yeah, but like it's still like torque to body ratio, I think they were saying, is still pretty good. It's just that
yep.
my opposite side is just fairly strong.
Strong.
Uh, yeah, I've been continuing to train it. Like obviously, if I didn't train it, it would be closer towards that 7%. But that's not the right idea to have there.
Yeah,
So
that's right. Exactly right. That's why I always try to make my patients, I guess comfortable in a way, and get them to sit with that comfort of being strong and asymmetrical. I'd rather you be strong and asymmetrical than weak and symmetrical, and it just gives you that push, and that seeing what your healthy side can do. It gives you a push of raising your current ACL side to that level of where your uninjured side is. So it's not a bad thing one little bit.
that's a good way of putting it. So
Uh,
yeah, so still working on strengthening, and then just now starting to get into some like plyometric exercises, some snap downs, and just preparing my tissue for hopefully within the next month being able to get back to running. So
yeah.
yeah, pretty
Yeah, cool.
fairly. There's definitely some weeks where there were no progress and we were doing the same thing just because my body was not tolerating more, maybe change up some variations of what we were doing. So every week early on was there was progress, but there, as of recent, some weeks have been pretty
Mm,
consistent with the previous week, or maybe some slight variations to it. So
yeah.
and then other weeks there'll be a jump from week to week based on how my body's tolerating things. So it's not like there's linear progress, but there's definitely some ups and downs throughout that process.
Yeah, for sure. And so with your patient hat on, what's kind of helped you sort of grind your way week to week? Has it been, when you go and have those sessions with your physical therapist and your colleagues at work, like is it the testing that sort of keeps motivating you? Is it just, it's the chats that you guys have? Is it, like that kind of camaraderie you've got? Like, yeah, just so, other people can sort of, I guess,
Yeah.
from what can we do as, with your patient perspective and your lens on, what can we do as physios to sort of help guide that, to encourage that progress, and for you to keep putting in that effort to turn up every week? Like, what's driving you there?
I would say for me, the probably the number one thing is seeing growth, objectively and
Mm,
subjectively. It's because I don't honestly, I'm so busy with work that I don't even think about my knee that much, which is a good and it's
mm,
a bad thing because I don't dwell on it, but at the same time, I I don't think to notice the improvements oftentimes, and I think when I do talk to them and take a step back, seeing how it feels and feeling the improvements, objectively seeing the increase in the amount of weight that I'm doing is a very positive reinforcement for me to continue to put the effort there. So I'm very growth oriented like that. The
yep.
the other piece of it, I would say, is just trusting the process and knowing that, because I can totally see how it's already been such a long process. I just feel like at some point I'm just this person with an injured knee, and that's going to be me forever.
Yep.
But you have to understand, based on the stats and based on probabilities of where you're at, like high chance that there's going to be a point, and talking to a lot of people helps with this, but high chance that I'm going to be to a point within a year that I don't even feel anything in my knee, and it just feels like the
Yep.
opposite side again. And
Yep.
sometimes you just have to remind yourself that, so that way you can play the long term game. And even when I get excited, I try to celebrate the wins a little bit, but not get
Yep.
overly excited where I start doing too much and get overconfident that I can do all these things. It's like, be humble. This is just part of the process, and and I'll just stay the course. And here's the plan to what you brought up earlier with having a clear plan in place is something that has helped me a lot.
Yeah, agree. It is hard to, especially when you have these little wins and you can see that progress, and it's like I still got to respect the tissue healing. I still got to understand that this, tendon that's been now sort of taken out from my quad, and it's now put into my knee as a new ACL that needs to mature, and that gap in the tendon now is going to fill up. That's going to take a long time to mature and develop, to handle the fun stuff that I want to do. Like we can't speed Mother Nature up, but we can certainly sort of work with her and keep things progressing. But yeah, it's having that good team and that good plan around you, 100%. Is what is being sort of a busy both physical therapist and business operator with the prehab and seeing the growth and having sort of a lot of busy lifestyle. What is, obviously that ACL would have impacted a fair bit. Yeah, I guess two things. What would have been sort of those hardest sort of challenges early on, and did you get any? So, and what were some of those silver linings to come out of those sort of hard moments? Because we all have really crappy, cloudy days, but of course there's going to be those silver lining moments that make us go, okay, well, it's going to be okay. The sun's going to come up tomorrow. So yeah, is there anything that stands out?
Yeah, that's a great question. I would say that early on, so there are things in your life that are removed because of the injury. And for me, that was a lot of like socializing with friends playing pickleball or tennis or going out to play sports. So that part is removed. And then also for work was working with patients, that part's removed. So you have to fill it with other things. And early on, I filled it with pretty much only work. And
Yeah.
so, and the crazy part about that whole thing is that beforehand, I was like, okay, what can I learn from this process? And a lot of it was like, okay, this is probably good because I can slow down, I can take a step back, kind of rebuild my body from like ground up again. Like I'm at this age where I'm starting to feel some other injuries here and there. So it's like a great way to, build it
Mm.
back up. I go to what is comfortable for me, which is just work. And so I did that initially, which I mean, not that I don't do still, but like I realized early on that you have to set these boundaries for yourself and making sure that you put together some non-negotiables and try to fill it in with things that uh, that still allow for you to be excited about the medium term, being that year mark, because it's a long process and you can't just push through it like maybe in a 1 month intensive rehab process. It's like a year is too long for you to try to push through. So
Yeah.
yeah, I've learned to just find balance in managing time with other areas that get me excited, like seeing friends and family doing different things than just playing sports, because that usually was my way of
Yeah.
socializing. In terms of work, there wasn't really much negative impact. It was much more, I would say, socially than personally, that it was more limiting, and it still is, of course. And I'm very excited to get back to playing sports and doing all the activities again. But I
Yeah.
don't try to think about that too much at this point. I just am excited for it and leave it at that.
Yeah.
And yeah, just focus on the now.
Yeah, no, good points there. I think it's yeah, some good lessons there is to sort of try and now find like a lot of people identify themselves with a particular sort of, thing, be it, being a sport, being in a group, whatever. And if that's taken away, it's often really hard. So it's just trying to sort of fill those sort of little gaps. And I think that work on yourself is really, really powerful. I know a lot of my patients will sort of turn to maybe reading or, sort of getting back into some of the hobbies just because now they can't go to training or they can't go to sport. So, they find different ways, but it's a bit, I think it's certainly hard early on is to sort of make that connection back to, things they may have previously done. But I think that's a really important message is to sort of try and not dwell on the shit you're going through and the tough sort of times you're going through acutely after an ACL, and certainly with the pain and stuff that comes after an operation. It's also trying to find what can you make yourself better at, and what areas of your life can you grow. in this sort of downtime. I think that's really important. I'll try to have that conversation with everyone that walks
Yeah.
in. Yeah. Well, Arash, you've been amazing insight and been a wonderful, wonderful guest. And I love talking to you. Just a couple of little things before we wrap up, because I know you have to go. Are there any words of encouragement or advice to people in our community who are currently going through ACL rehab? You may have already touched on a few things. And then finally, after that, is any advice to physiotherapists? So some advice to patients with your patient hat on, and then also to our physiotherapists as well, to help our patients go through their recovery better.
Yeah, I would say for patients, trusting the process is very important, and that's what I remind myself oftentimes. After you've done your initial research and you find the team that you like, especially working with your physio, you're going to be working with that individual for quite a long time. A lot of it is just leaving it up to them with guiding you the right direction and making sure that you do the work that you need to. I know some people might have difficulty with being compliant, but at the end of the day, uh, the timeline piece is not just the timeline. I think that people oftentimes are like, let me just wait until that 9 to 12 month period, but there's a lot of work that needs to go into that, and you want to hit those criteria so that way you're best prepared to be set up for success when you get back to playing sport. It's clearly not just a timeline based approach for patients. Yeah, try to be as patient as possible with it. I think you've hit on some good points with filling in that time with other pieces. I think creating the expectation up front as early as possible is helpful. Like I think even talking to Nima and then my PTs, like it's like, a lot of people have mental struggles going through this process. And, I've been pretty fortunate with things, but I created the worst expectation for myself and tried to prevent these things from happening, knowing that this could happen, right? So like making sure I'm overly social and doing these things that people usually completely drop, especially that I thought I was prone to. So I think trying to get ahead of the issues and being more proactive would be very helpful. And I think that from a PT standpoint or physio standpoint, as I do research, I see so much information on exercises and movements and how to progress that, which is very important. And it has to be there. But the education around lifestyle, talking about these things of like, hey, by the way, like this is going to be difficult, like find ways to spend your time doing things that you enjoy, find hobbies, like these extra things that oftentimes are overlooked because if someone is not excited about things or gets down on themselves, then they're not going to do the exercises, and making sure they're taken care of as a whole. And maybe there's a good amount of physios that already do this, but I found in talking to some people and doing some research that education piece was largely missing, and probably the most helpful, because the exercises are much more objective, like black and white. Here are the things that you can progress through. This stuff is like kind of you're figuring things out that work for yourself, and it's a long process. So the idea of pushing through it is not going to work, or it can only work for so long.
Yeah, agree. I love that point, is to encourage to have those hard conversations. Like it's called soft skills, but it's actually a really hard part of what we do as physios is to actually have these often difficult conversations about how you're feeling, how's your mood, how's your it's not hard to ask someone how their sleep is, or are they worried about things. And I think what is difficult is then trying to help them come up with the solutions to, and you as a clinician may not have the solutions. We just have to try and sort of get the patient to think about the things that can fill that void, so they can continue to pick their mood up and continue to stick to the program, stick to the plan. Because they're often really tricky conversations, particularly if someone's in a flat mood and really struggling mentally. They're soft skills, but very, very often uncomfortable conversations we just need to get comfortable with. So Well, Arash, you've been amazing, and mate, I'm actually hopefully will hold you to this. I want to see what you like at 12 months. So we might come back if you've got time and energy, and keen to do this one again. We'll check back on you in about 6 or 7 months' time when you hit the 12-month mark and see how things are going for you.
That would be awesome. Would love to wrap this up full circle and hopefully have some success stories for you.
Yeah, awesome, mate. Well, you've been wonderful insight, 3 or 4 months into your journey. And thanks very much for sharing your story so far, mate. We can't wait to, I guess, see how it all plays out for you over the next 6 months and beyond. So thanks once again for your time today.
Yeah. Thanks again for having me. Great chatting.
Cool. All right, ACL Hubbers, that's it for today. Stay tuned for our next episode of interviews on the ACL Hub. And until then, see you next time.